Hello, friends. We are starting with a new chapter that is Communication of Health Education, and today we are learning about approaches to health education. This lecture is extremely important as many questions are asked from this topic. So, let's get started. So, why communication is important? Communication and education go hand in hand. When we communicate the right way, people learn better. The goal of communication is to bring about a change. It could be helping someone understand something new, change their attitude or behavior, or learn a new skill. These are the main goals of learning. It helps people to change their behavior in a good way, like adopting healthier habits. And in health education, these skills are very important. So, what is health education? It is not just about giving information, it is a process. It is a process that aims to encourage people to want to be healthy, to know how to stay healthy, to act in ways that maintain health individually and collectively, and to seek help when needed. The purpose of health education is first, we want to encourage people to adopt and sustain a healthy lifestyle like eating well, staying active, quitting tobacco, practicing hygiene. Second, we want people to use health services properly. That means understanding when and how to assess things like immunization, antenatal care, screening, etc. Third, and most importantly, we want to equip individuals and communities with the knowledge and skills they need to solve their own problems at an individual level and community level. The four approaches to health education are regulatory approach, service approach, health education approach, and primary healthcare approach. So, first is regulatory approach. What do you mean by regulation? In simple terms, regulation means any action by the government, direct or indirect, that tries to change how people behave, especially to improve their health. This can include laws, rules, fines, even imprisonment. This is what we call as the regulatory approach. The idea is to use an external control, like a legal pressure, to push people towards healthier behavior. A person breaking the law can be punished by the government authorities, and the punishment can range from imposing a fine to imprisonment. For example, in India, Child Marriage Restraint Act is a law that is to prevent child marriage. There are laws making seatbelt compulsory, ban on smoking in public places, ban on the sale of alcohol to minors. If there is a risk of transmission of disease to other, regulatory approach can be used. Now this might sound like the easiest and the fastest way to change behavior. Just make a law and people will follow it. But it's not that simple. There are important limitations to this approach. First, you cannot eliminate disease just by passing a law. For example, no law can directly stop diabetes or heart diseases. Secondly, many health behavior involve personal choices like what you eat, how much you exercise. You can't force people to eat healthy or not to smoke at home through a law. It would feel like taking away their freedom or personal rights. Laws only work well when people are ready to accept them. These can be helpful in emergencies like controlling an epidemic or managing big gatherings, but to really succeed, law needs community acceptance and a large administrative force. There are many health problems like smoking, using clean water, or family planning that can be solved by health education. This requires people to understand, choose, and change their behavior. And that's exactly where health education comes in. People should have control over their own life, including health. Instead of being ordered what to do, they should be informed and empowered to make the right choices for themselves. That's one of the highest goal of health education. So how do we do that? We educate people through planned learning, giving them give them correct information, motivate them to live healthy life. This method take time, but it creates long lasting change because people are making the choices themselves, they are not being forced. This approach matches with the democratic values where we respect personal freedom and decision making. The key here is to encourage the people and not to command. We need mass media, TV, radio, social media, and local organization to help spread positive attitude and health habits. It's important that these messages don't go against people value or else they may reject them. Behavior and attitudes form early in life. So if we want real long-term impact, we must start health education with children and young people. It is much easier to shape good habits in youth than to change bad habits in adults. The third is service approach. In service approach, the services are provided at the doorstep on the assumption that people will use these services to improve their own health. For example, immunization clinic at a village providing drugs for treatment. Service approach fails when the service is not felt need. For example, people did not use latrines even after they were built by the government because it was not their habit. The fourth approach is primary healthcare approach. This approach is bringing about a community change through active community participation and intersectoral coordination, which is based on the principle of primary health care. The community is actively involved in planning and delivery of the health services. The community is guided by the healthcare providers to identify the health problem and solution for it. For example, Village Health and Nutrition Day planned by the village Gram Panchayat with the help of ASHA and ANM and the Anganwadi workers. So with this we have come to an end of this lecture. If you found this helpful, like the video, share it with others and subscribe for more.